Ladies and gentlemen, welcome to the European Health Forum on this marketplace to exchange the latest ideas on the health policies. Thank you all for joining us here, face-to-face, in person, and also online. It's a big and great pleasure and honor that you're all here, and I would like to extend these greetings on behalf of my board, the advisory committee, our wonderful team, Ms. Dorle Carr and her team members. Thank you very much for organizing us and bringing us together here in Gastein. Thank you very much. This year's European Health Forum is taking place against the backdrop of challenging and increasingly chaotic times. You know what the Chinese say about chaotic times. It's better to be a dog in times of tranquility than a human in times of chaos. It's not only the war in Ukraine, of course, or the humanitarian crisis in Gaza, the hate and the craziness of Hamas and the response of the government in Jerusalem, which lacks any semblance of reason. And we are all confronted day by day with an increasingly stronger dose of lies, greed, meanness, the new paradigm of politics of Trump's United States. The reason that we, the board and our advisors, decided on this year's general topic, Rethinking Solidarity and Health, Healing Europe's Fractured Social Contract, is quite simple. We are living not only with all this hate, craziness, and idiocracy, my new buzzword, but also in a time of dynamic political change in Europe. You can call it living with many dimensions of uncertainty and uncertainties. To name a few of these challenges in the context of solidarity, governments in the European Union are being encouraged by external forces to substantially increase public budgets for defense to as much as 5% of GDP, as we all know. During this last year of 2024 alone, EU member states increased defense spending by, and you probably have this number in your memory, 19%. The cost of addressing climate crisis and decarbonization is similar high. And we shouldn't be naive. This additional government spending, coupled with the unpredictable impact of AI-driven automation across nearly all sectors of economy, its unforeseeable consequences for the labor market, as well as the demographic aging in Europe, directly influences the sustainable financing of solidarity systems in Europe. So it's high time to wake up and to start reflecting these political developments for our sector. Why? All these developments will have massive impact how we finance, how we organize the level of and the access to health services, and how we guarantee the current high level of quality. The financial and economic ramifications affecting health care and long-term care systems will change. That happens already, today, tomorrow, and we will see the consequences in the next years to come. Just look at the financial situation of large health funds, sick funds, and the pension systems in the European Union. They are already suffering. At this pivotal moment in history, what is at stake is nothing less than the legacy of post-war political consensus, the creation of social justice through the legal framework of welfare states, the introduction of progressive income taxation and social security contributions. This is, and was so far, an expression of the political will to bring about the democratically legitimized redistribution of assets and income in favor of social participation and the establishment of social justice. This is the core of the social contract as I understand it. But that's not a given anymore. The principle of solidarity faces challenges from the dynamic growth in additional government spending. I already mentioned that. My personal most highlighted observation in that regard, in an interview before the NATO summit in The Hague in June 2025, NATO Secretary General Mark Rutte summed up his picture of the future. Europeans, he warned, could continue to prioritize spending on health and pension systems, but without also investing substantially in defense, we might as well start learn Russian. Take it from there and think about that. It sounds a little bit cynical, but he said it. I would like to even broaden your awareness. A basic principle of the functioning of solidarity system is often overlooked, especially in our health communities. While there may be differences in the organization of solidarity systems, but essentially all solidarity systems are paid for mostly by progressive taxes and contributions on earned income from work performance and employment. This basic principle has so far been one of the strengths of the solidarity systems in economies with a broad middle class, and also especially with the increasing employment rate among women over time. However, this basic principle, and thus the inflow of funds, is not secured in the long term. Already in the last 20 years, and we all know that, in industrialized countries, earned income from labor has stagnated compared to capital income, which, as we all know, is largely decoupled from contributions to the solidarity system. The ongoing deindustrialization of Europe leads to an increased loss of well-paid industrial jobs compared to the jobs in the service sector, especially retail and tourism, and the rapidly growing logistic industry, and age-related developments in the population pyramid are leading to a rapid exit of the baby boomers like me from the active labor market. If you add this up, we must expect that there will be dramatically fewer people in employment. And all these factors together naturally slow down the growth of contributions to and tax revenue for the solidarity systems. The biggest political and social challenge for solidarity systems still lies ahead of us. I'm talking about the rapid digitalization and artificial intelligence, especially in their potential impact of the labor market. My take on this, AI will drastically change, even might obliterate, the very foundations of the social contract as we know it today. Naturally, historic predictions are difficult, especially when it comes to developments and of employment and the labor market, and I do not want to oversimplify the issue here. But the political and social question in the context of AI parts is rooted in the critical assessment of whether AI merely replaces individual tasks in the context of work processes or takes over large parts of the workflows, thus eliminating human workplaces. Those are the two options we have to consider. The second scenario is the assumption, by the way, in the whispered conversations of the big tech investors. Their macroeconomic calculation of the return on investment in AI can only work out. So they say, if the automation stimulated by AI leads to a broad reduction of costs, meaning labor costs, meaning a significant loss of jobs. Keep in mind, the decisions on how much capital to invest in this developments is made by financial investors and not in parliaments or cabinet tables of governments. There is no political discourse on how far the dehumanization of these technical developments should extend. The social and human costs which investors in AI simply externalize are not a perceptible political issue in the political center in the moment. Economists, like from OECD or World Bank, have so far assumed that the use of AI creates a benefit, both in the productivity of service provisions and in new employment opportunities. They assume that this applies at least to job creation in the tech industry itself and in the broad field of research, especially in life science. And of course, no question, in these areas, especially in medical research, AI will bring enormous benefits. But the situation, on the other hand, in many other industries is totally different. And nowadays also different for skilled industries, such as banking, finance, legal, and all the consulting services. Why am I saying this? Eric Schmidt, and I like to quote him on this, Eric Schmidt, the former CEO of Google and a major investor in AI as well, is all over the media and assumes that in the next 5 to 8 years, this is the time horizon from 2030 to 2033, the codes, he says, used in AI will have reached a quality corresponding to 80 to 90% of the skills and knowledge of the top experts in their respected fields. He assumes that even the best programmers and mathematicians will become superfluous because of the self-learning AI systems. Schmidt, as one of the great drivers of AI, also believes that these developments are completely, and this is his word, underhyped in the broad social and political debate. So we have to ask us, what does it mean in the context of the European Union? In 2024, the new European Commission declared that it has two main tasks: to secure the Union's geopolitical competitiveness in relation to the US and China, and to overcome stagnating economic growth. And we all know the blueprint for achieving these goals is outlined in the so-called Draghi report, The Future of European Competitiveness. It states that no economic growth in the EU will be possible without a significant increase in productivity. To put this issue in the context of the new social contract, it is indeed important to note that the European solidarity systems cannot be maintained without economic growth in the EU. The Draghi report, as we all read, probably calculates that for the European Union to remain geopolitically competitive, it needs economic growth of an additional 5% to be able to invest comprehensively in digitalization, decarbonization, its defense capability, and its security and economic independence. This enormous economic effort requires an increase in productivity and, in turn, massive investments in Europe's innovative power, meaning support of European digital technology. What I'm trying to drive home here, in the context of a new and revitalized social contract for European societies, it is politically imperative not to focus solely on the competitiveness of the European economy. Equally, and at the same time, we must discuss and politically initiate steps to protect the solidarity systems in the long term and ensure the social and economic participation of as many segments of the population as possible. The political call of the economic elites to strengthen Europe's innovative power as forcefully as possible will come to nothing if at the same time we ignore the political concerns that the innovations of the tech industry have the potential to dehumanize economic activity and weaken human labor and the associated systems of solidarity. Let me give you one example. Hand in hand with better governance to reach the goals of innovation and productivity growth, politics must highly prioritize discussions regarding a total reformation of the tax base. This is especially true to subsidiate stagnant taxes on revenues from labor income. OECD, by the way, is working on these frameworks to reformulate tax codes. The globalization of trade, as well as the digitalization and automatization, call for multilateral tax agreements to secure fairness as regards to robot tax, of taxation of AI and digital systems, or the usage of data. Let me finish with a last thought. The rise of right and sometimes left-wing political populism, which seeks to hit existing systems with the big wrecking balls, can be traced not only to the paralysis of fear about the consequences of migration, but above all to the social insecurity among the broad basis of voters due to modern innovations they view as threatening. Therefore, a serious debate about social contract as a human balance to the capital-driven intentions to promote technological innovation is one of the last chances to protect the liberal democratic state under the rule of law from both authoritarianism, right or left, or the big tech business oligarchs. That is why we chose this year's main topic for the European Health Forum. That is why I want each and everyone here to start thinking about the urgency of this matter. This is why I want to stop the fact that this topic stays underhyped in the political debate. And that is why I want us to remember over the next 10 years that we started rethinking this topic here in Gastein in early 2025. Thank you for your patience, and I apologize for this rather gloomy outlook in the future. May I ask now the State Secretary of Health of Austria, Ulrike Königsberger-Ludwig, for some words of welcome and her take on the rethinking solidarity and the social contract. And after her, I would like to invite Nick Fahy. He will take the role of the moderator for our panel on this topic. Thank you very much.
Thank you, Mr. President, for the very important words. I take it with me because I think it's really important to think all about you speak before. Dear ladies and gentlemen, dear friends of the European Health Forum Gastein, and I want to say dear family of health from all of Europe. It's my great pleasure to welcome you to the 28th Annual European Health Forum in Gastein, an event that the Austrian Ministry has co-organized since its inception. In my role as State Secretary for Health, it is my privilege to welcome you to the beautiful Gastein Valley to discuss this year's topic of a renewed social contract. At the heart of any democracy lies an unspoken agreement, a social contract between the people and their government. It is not written in a single document, but it is felt in every policy, in every vote, and every act of civic engagement. As a state, we have the duty to protect and promote the health and well-being of all citizens, ensuring access to quality healthcare, sound public health measures, healthy living conditions, and effective social support systems that are also fit for future generations. Just as the government has this duty to protect the citizens' rights, ensure justice, and create opportunities. In return, citizens have the responsibility to support their own health and well-being and enhance that of the wider community. In Europe and beyond, we are facing many challenges that fundamentally impact health systems. These difficulties cause the ties that bind us together to become stretched. It is our responsibility as a government to prevent them from breaking. The social contract is especially important in times of crisis, where collective action and trust in public institutions are essential. It requires transparency, fairness, and equity from us as leaders, and relies on solidarity and civic responsibility from the public. Without that mutual understanding and trust, public health efforts can crumble. In Austria, our long-term goals are to improve the quality of life into old age through a sustainable and solidarity-based health system. We can achieve this through a variety of means, including enhancing prevention efforts, adopting digitalization, using AI to support diagnosis and treatment, and strengthening citizens' health literacy. In turn, we as citizens must stay informed and hold leaders accountable. We as citizens must participate, not just when it's easy or popular, but especially when it's difficult, because democracy is precious and requires a collective effort. The social contract is not about perfection, it's about partnership. It's about a shared commitment. When governments listen and when citizens change, we create the kind of society where freedom and responsibility go hand in hand. That is the promise to the social contract, and it is up to all of us to safeguard it. And I'm very happy to stay here with you in Gastein, because I'm sure it's very important to listen and to discuss, because so we all can learn from each other. And I think this will be one of the important points to strengthen our social contract and our solidarity health system in Europe. Thank you for being here. Thank you for your work in your countries, and thank you for your expertise. And now I wish you a very interesting and enjoyable days in Gastein and fruitful discussions on these crucial topics. Thank you for being here.
Thank you very much, Herr President Auer. Thank you very much, Madam State Secretary. Let me add my welcome to you all to Austria and to this European Health Forum, Gastein, and this important topic which has already been set out so well, rethinking solidarity in health and healing Europe's social contract. The rest of this session is going to be an opportunity to really engage with this through a panel of very eminent speakers representing different perspectives from politics, from officials with leading responsibilities for the upholding this social contract throughout Europe and across civil society as a whole. We will also be, though, beginning with your own participation in this, because we will, as well as Floris and Christina from the newsroom and from the cartoons, we'd like to begin with your impressions through Slido of what Europe's social contract means to you. So if we have the Slido connection details, please take a moment. I'll get out of the way of the screen for you. And the question is, describe in 1 or 2 words what the European social contract means to you. We've heard from Clemens about the challenges facing the social contract, from the State Secretary about the importance that this represents and our opportunity to address it. So please express in a couple words what you think Europe's social contract means to you. And while some of you are still finishing that, may I take this opportunity to invite our speakers for the panel to come up and join me on the stage, and please join me in welcoming them as they do that. Thank you very much. So, I will introduce each of these different august speakers. You can see who we have up on the screen, but I will introduce people as we go through. Madam Minister Pravonnik Rupel from Slovenia, thank you very much for coming and joining. We just heard from the Austrian State Secretary about her perspectives on the European social contract. From your perspective, what does the social contract mean to you and to your work as a health minister?
Thank you very much, and hello to everyone. I'm really happy to be here, and especially this very, very important panel. So what is a social contract to me? Since everybody is already answering, I don't think that my view differs so much from what is set on that screen that used to be up there. Social contract is an agreement. It's an agreement among all the stakeholders in the healthcare system. Patients, policymakers, doctors, nurses, all the employees. And this is something that tells us that social contract is about responsibility and about cooperation. Why is social contract important? It's important because it stands for universal health insurance, universal health inclusion, so that all of us have access to health care. And that since we all have access to health care, there is less inequalities in the healthcare system, in our health. So our health is more equal because we all have access. As we heard, social contract has two sides of the same coin, which was really nicely told by the speakers before. The first side of the coin is the contributions into the healthcare systems, and we know that there are challenges, change in employment patterns, technological advances, aging, everything. On the other side of the coin, we have needs of the population, where we know that things are changing. People are again aging, we have new treatments, new medicines, new applications coming up that change the demand as well. So in all these changes, it's not really so amazing that we see that the social contract is kind of fragile. It is actually expected, and we need to react. Now, if you ask me, as a minister, what to do, you know, it actually comes down to each single day and each single decisions that we take. Because in this, you know, between two stones, or between these two sides of the coin, which is supply and the funds and the availability that we have on one side, and on the other side, the needs, not the wishes of the population, we have to find a way forward, that we keep the solidarity, the universality. And then you just weigh each decision. And how do we make people trust that we weigh correctly those options? When we make each day the decisions, will we invest in prevention, promotion, primary care, some specialized treatments, rare diseases? What will we do? we have to talk, we have to cooperate, we have to each stakeholder in the system take on the responsibility. Each of us has a role in the system, whether we like it or we not. But we are responsible for what we do. The patients are responsible, need to be responsible, civil societies, policymakers, as well as employees. And that's where we have to cooperate. So basically, what we have to do to make the social contract going on, we have to talk. We have to talk and discuss and find the proper solution and way forward. Otherwise, we cannot win if we all want maximum from our own viewpoint. We have to discuss. And this is where social participation, communication, cooperations come in. I think that's the only way forward, to have the evidence ready, to have the data ready, and just confront our opinions and see what is the best way, what's the correct way to go forward. And our final goal from all stakeholders in the system should be to achieve the best health outcomes for the population.
Thank you. Thank you very much. I think that that message of the importance of communication and engagement is a perfect introduction to the Health Forum Gastein. That's exactly what we hope to see over the coming days. Mr. Schmidt, as the former Commissioner for Jobs and Social Rights, all of these issues, what we see on the screen of solidarity, of trust, these were issues central to your heart and to your perspective, I'm sure, but we've always had this tension in this social space between what is a national solidarity and what is the European dimension of solidarity. To what extent is there such a thing as a European social contract, and what do you see as the role of the EU in relation to national solidarity?
Well, after World War II, our societies were built on the idea of a social contract to support democracy, and with the idea of a social market economy. And the creation of the first community, steel and coal, but also the European community, finally were inspired by this idea. So, considering that the social sphere should be left to the national level. But at the same time, from the beginning on, it was clear that the European project had to be compatible and supportive of the national social contracts. So, not on one hand the national contract and then Europe being in contradiction. So it's about social dialogue, involvement, but also the idea that, well, our societies have to achieve a certain level of justice, of fairness, of protection of all kinds of groups. So now, the more we integrate it, the more it became obvious that Europe in this context had not just to recognize and support, but had to be part also of this kind of social contract, which does not mean the European social contract is different from the national ones, but it has to be on top of the national social contracts to support them, to make them solid enough. And this is the big debate, by the way, because globalization has attacked the national social contracts. But it has also gone through this idea that Europe has to protect this national social contracts. And for many people, the idea was, well, Europe is the other side of globalization, and it finally undermines the national social contract. And that's the first step of this Euroscepticism. And that's why it is so important, as I've listened to the President's speech, it's so important to make sure that Europe has for itself also this idea of a social contract. And when we started to have a monetary union, when we started to have a more and more integrated economy, you cannot just say we have an integrated economy, but social just take care at national level. No, there are a lot of impacts from Europe on the social on the social fabrics in the different member states. It's not now to say we have one social system for all Europe. No, that's not the idea. But we have to get this idea, as somebody, I think it was last year here, Van den Broek, said, well, the social union is a union of welfare states. That's the idea of the social contract at the European level. And I think this is the big challenge. And if we neglect now the social dimension of the European Union, this will create problems for the national social contracts, which are already under heavy pressure. Some even say threat or even fragmentation, or even some think that the social contract is broken. So, and I think that's why I worked on this a lot. That's why I have to say the previous commission adopted the pillar of social rights. Because after the financial crisis, it was obvious, and the financial crisis was really a big shock for our, not just for the economy, but also for social systems. There was an awareness that we needed exactly a social, not just message, but also some kind of a roadmap to rebuild the social or strengthen the social system in Europe. That's the pillar of social rights. And that's finally is the social contract on national and at European level.
Thank you very much. And thank you for drawing that thread of the European social contract, both in link to and in an essential complement to that national social contract, and the combination of the two. We're joined as well online by Sandra Galina. It's a pleasure to see you, Sandra. It would have been even more a pleasure to see you in person, but thank you for joining us online. Mr. Schmidt has painted...
Apologies, you know, it's, my leg is kaput.
Sandra, I wish you weren't living the context of health quite so...
It takes more than just a leg, you know. I will survive.
So Mr. Schmidt was drawing for us the really big picture of this connection, this commitment of Europe to the social contract. Yeah. For you, as the Director General of the Health and Food Safety DG, there were terms we saw in terms of access to care and inequalities. What do you see as the responsibility of DG Santé specifically in relation to this European social contract?
Yeah, Dr. Fahey, thank you for this introduction, and thank you to all the previous speakers. I'm very honored to be in this panel, preceded by such honorable speakers. So, let me start with reality. DG Santé bears a central responsibility to protect and renew the European social contract, whichever way we want to describe it, where it matters most, people's health. So, I'm sorry to say we have une lourde responsabilité. I will list a few of the ideas that I have in my mind when people ask me what's yours. Well, affordable healthcare. This is part of the social contract. I mean, 20 years ago, the member states agreed on common values and principles for health systems. There was the universality issue. There was, I would say, equity. Equity was also there, and solidarity. So let me say this is full blast into what you are discussing this afternoon. We also have, I would say, healthcare, whichever way we want to see it. Health is not the absence of diseases, by the way. So healthcare system needs to be there, and the Slovenian minister was right. The difficulty is in the choices that you have to make every day between what the people wish and what the people need. So the 20 principles in the European Pillar of Social Rights, we have also health there. We are committed also to working together and not in isolation, so that would be spending a word for solidarity too. I want to refer to the EU for Health program, which was a bountiful program at the very beginning. Then it was cut in two, so we were left with half of it. We then had to forgo 1 billion because of the war in Ukraine, and rightly so. We had to also make our bid to contribute. It's always important to be solidaire. But at the end of the day, with this EU for Health program, we are trying to improve the affordability and to distribute the benefits a bit more fairly, to reduce the barriers for the vulnerable groups. We can quote many activities, amongst others, the, I would say, Europe Beating Cancer Plan, but also the digital part is financed under the EU for Health program. And we strive to make, I would say, a distribution that is fairer between the member states. Now, it is also a bit up to the member states to leverage their potential. Let me say that with what I'm seeing, I'm optimistic. I'm optimistic that we will improve health coverage, we will reduce disparities, we will break down barriers for people with disabilities. Obviously, this takes a lot of work, and as I was saying in the previous session, labor omnia vincit. We need to just be steady and go on believing in what we do. Now, there is a lot of this that feeds into the European semester. I will not go there because otherwise it becomes quite complicated. At least 6 member states last year got a specific recommendation around access to healthcare, which means that these 6 member states have issues. There is the problem of the staff shortages, where I must say it's quite a difficult one because, no matter how much you plan, no matter how much you do for nurse retention or you have optimal skill mixes, there is always a bit of an issue with the workforce. And we try to support the member states in what they're trying to do so that there is a harmonious sharing of the workforce in Europe. Now, there are various flagships that we have been working on. All the legislation basically has been reopened since I am here in DG Sante. We are now going through the last stages for the Pharma Review. We are going also into discussions for Critical Medicines Act. I think that the European health data space does not need to have an introduction as a mechanism that could unlock data for research, could give personalized health, could do a lot for the social contract, including reducing costs, because the sustainability of the systems relies also on the fact that the costs need to be bearable by the member states. Now, may I say though that we still see health inequality across Europe. We will still work with the member states to reduce it. I'm an optimistic person. As I was saying, innovation can help. But there is the issue of clinical trials, which is attracting quite a lot of attention at the moment, and rightly so, because this is sometimes the only way that some patients have to access very innovative treatment. There will be a cardiovascular plan. The Commissioner Varhelyi is very committed to this plan. There too, there are inequalities, inequalities that border on the inequity, if we want to be very precise. Now, I think that as policymakers, we try to work also in a more holistic way these days. We are not sitting on a file limited to health, because this is an all-government approach. Health is affected by many issues: education, employment, as was mentioned earlier by my good old friend Clemens, even housing. Even housing affects, and so much also health. The environment, let me say, environment, we can see many studies where, there is a causality link between the environment and certain diseases. So what do we try to do in DG Sante is to listen to the people's voices, to ensure that these voices are, I would say, presented within a European Health Union discussion. So we should not only attend these debates as patients, but also as participants shaping the policy. So I would say we have many stakeholders that take part, and it's not only when you are ill that you want to know how the healthcare system is taking care of you. You want to shape it before that. I would like to say as a final bullet is that we will do everything to honor the social contract. But in that, we need to make choices, and there's the rub. The choices sometimes are quite complicated, and for the ministers, it's not easy to cope with the different demands.
Thank you very much indeed. And Sandra, you set out both a commitment to this social contract, but also the range of tools and technical challenges that you face in seeking to achieve that, both within your own Directorate General and across the enormous range of policy issues. You're supported in that work by several specialist agencies, and we have the honor of having two of the heads of those agencies with us today. Pamela, could I turn to you first as Director of the European Centre for Disease Prevention and Control? We all saw very recently, only a few years ago, the importance of these issues. What role do you see for the ECDC in healing the fractured European social contract?
Well, thank you, Nick, for the introduction. Thanks for the invite to this very important, highly political, actually, panel. And I'm very happy to be political in this sense again, because health is a political issue. And I would like to use my intervention to call for a more optimistic approach. And also, when I'm looking at the wording, you know, I wouldn't like to focus too much on healing, because healing, as a medical doctor, if I hear healing, it implies that the social contract is a patient and is sick. I don't think that the social contract is really at that stage. And I don't think that we really need a total new social contract at the European Union. I really call for more, well, I think we should be more proud of what we have achieved in the past 70 years. And going back what Nicolas said right at the beginning of your statement today, going back to the beginnings. At the beginning of the social contract of Europe, there was a strong cooperation promise, coal and steel mentioned. And it's about this cooperation, solidarity. And this is extremely strong. And built on that, we developed, I think from my point of view, speaking as a European proud citizen, I have to say one of the most unique organizations worldwide, on the most unique continent. And apart and despite all the problems we are facing, yes, we face social inequalities, growing social inequalities, many more, climate change, wars, many, many other things. But despite, the European Union and Europe is still one of the safest places to live. It's still one of the most social places to live. It is still one of the more, despite the war in Europe, a peaceful place. And our healthcare systems, compared to other globally compared healthcare systems, are still one of the best. Does it mean we don't need any? Well, does it mean they are perfect? Does it mean the social contract is perfect? Does it mean the healthcare is perfect? No, no, no. We see a lot of challenges, and Clemens has pointed out the whole wide and growing range of challenges and healthcare and threats approaching. Yes, this means, and this should be a constant process, and it has been a process in the past, that we all jointly together, we need to work together in order to adapt our social contract according to the new challenges current and ahead. So it means also, and this now I come to the ECDC's role, cooperation, going back to the start. For us, concretely at ECDC, what does it mean? It means that we cooperate much, much more with the member states. This is not only the beginning of the European Union, this is the big lesson learned for us from the COVID-19 pandemic. We need much more cooperation with the member states, between the member states, with the EU institutions, with international partners. All this is essential. So for me, concretely, it means that since last year, following the pandemic, following our experience, ECDC opened up. We opened up, we changed the way we work. We go with our experts directly hands-on, on the ground, to the member states and work with them in 1 week's mission in mixed teams together with experts from the Commission, from WHO, and work on preparedness action plans. We work on any other issues and problems they are facing in their public health systems. So why do I mention that? Because this is, I think, part of a new, stronger and bold cooperation. There is a need for a bolder and stronger cooperation. And the member states, if you ask me like this, as ECDC director, they are the most important partner for us. They're most important partner because it's a win-win situation to cooperate like that, in this new way, in this It's a game changer for us. Why? Because by that, we better get to know each other, we better understand each other, and we better trust each other. And this enables ECDC, as the European Centre for Disease Prevention and Control, to really provide a better fitted, tailored, support for the member states. And coming to the big issue of solidarity. I mean, yes, solidarity. 20 years ago, ECDC was founded on this value of solidarity. Solidarity between the member states to enable every member state to benefit from the modern, harmonized public health systems in order to be protected against any public health threats. So my final sentence, ECDC has to, and we will, and we are, to work smarter and closer than ever before with the member states.
Thank you very much, and thank you for insisting. Thank you for a shocking note of optimism, Pamela, and for insisting on the importance of everything that we have achieved, and it is still there. Emma Cook, if I can turn to you as Director of the European Medicines Agency, one of the things that we achieved was a structure of regulation built on trust in science and evidence as a key part of Europe's social contract. But we have seen that being challenged, for example, with vaccines. How can we best respond to that challenge?
Well, thank you very much. And I think I should also be a little bit more positive here than I was intending to be, because actually we have done a lot. Yes. And I think we should be proud of what we've done. We have a European system that ensures that the vaccines that go on the market are safe, of high quality and effective. That I believe. Now, I believe vaccines work. I believe vaccines save lives. And I believe that the European vaccine strategy was an absolute game changer in the context of the pandemic. Okay, these are success stories. Now, the problem is not everybody believes that too, or not everybody believes that anymore. So how do you pass this message when people have a different view, when people don't have the same background? And I think that's some of the things that we're challenged with at the moment, and certainly from the European medicines regulator, not just as a regulator of medicines, but as a communicator. So we're thinking all the time about how we maintain the trust in the work that we do, how we communicate that to everybody, not just the believers, but also the non-believers, and how we do things differently in a world that is very different from the world we were created in 30 years ago. But we still have that basis of scientific expertise, of collaboration and coordination that we're proud of as Europe. So 3 things, I think, that help us to make a difference in the belief in what we do. I think the first thing is making sure that we have the voice of the patient, and even here, I would say it's the voice of the citizens. We have to make sure that we're listening to the voice of the patient. We're listening to the voice of the citizen. And we do this through our public outreach, through our healthcare professionals working party, through our patient and consumers working party. I think transparency and trust, you cannot underestimate the role of transparency and trust. And we are very proud to be a European medicines regulator who has probably the most transparent regulator in the world. We publish every decision. We publish the reasons for our decision. We make them available on our website. We answer questions about them. We're ready to stand up and be counted for these. And we publish all the clinical data on which we make these decisions as well. So we are transparent and open. Now, we still have a challenge in terms of communication because we're a scientific-based community, and not everybody understands a scientific-based community. So we also have a responsibility to make sure that the messages and the confidence in our assessments is communicated in a way that less scientific people can understand. And this means that we have to be thinking all the time about how we communicate and how we communicate in today's world, which is different to how we were set up to communicate back 30 years ago. So we're looking at monitoring the media, the social media, to see the sources of misinformation, to see how we can counter that with fact-based, evidence-based information. We're looking at how we can use social media better. So can we use content creators to help spread some of our success stories and messages? We're using partnerships with learned societies, partnerships with the Pediatric Academy on vaccine essentials, for example, to make messages that resonate not just for regulators, but also for patients and healthcare professionals. But I think we have to keep thinking differently, and we have to keep up to date and relevant. And today I had the pleasure of talking to a group of young Gasteiners, and I asked them this question, and they said, I said, how do we become, I'm 64, I think that's on my, everybody knows. I mean, I am not, I'm not a young Gasteiner. So I don't think TikTok, I don't think Instagram, I just about, can manage LinkedIn, and we do a lot on LinkedIn, and we're doing podcasts and we're doing YouTube, but I'm not thinking the same way as the people I'm trying to get to listen to me. So I think we have to listen to how you communicate in today's world.
Thank you. Thank you very much indeed, and thank you also for. So the Minister started with the importance of talking and engaging, and you've emphasized some of the challenges involved in doing that in the modern world, I think. But throughout all of these interventions has been the importance of engaging, of participation, and of citizens. So let me turn, Michael, to you. Michael Ley is the Secretary General of Solidar, which is a network of civil society organizations advancing social justice and a just transition. So much about communication and engagement. What role can European civil society play in renewing the social contract for health? And what are, to Emma's point, what are the most effective tools for engaging citizens and communities in this process?
Thank you very much, and thanks for having me on such a distinguished panel. It's a pleasure to be here in Gastein and to join you all in this plenary conversation. I think maybe a few of you wonder why or what is civil society doing here or is relevant to this discussion. I think there are several points that you've been highlighting throughout the conversations that is essential to civil society's role. It's about building trust. It's about delivering services in their own right. And it's about creating public space that fosters belonging and collective action in the real world. And I think perhaps in times of shrinking democratic space where there are ongoing and quite massive and targeted smear campaigns against civil society and civil society's involvement in policy making and engaging in discussions, to just remind ourselves what is civil society and what do we actually do in society. And well, so first and foremost, perhaps in this context, we deliver health services. There are a lot of civil society actors who are engaged in hospitals and ambulance services, care, trauma and support centers, psychosocial education and support, etc. We organize voluntary services. We talked about COVID-19 pandemic. One of the main lessons from that awful situation was perhaps how difficult it was for the state to find their footing throughout the pandemic, and how much of what became the sort of immediate response, the first response to this pandemic and crisis, was executed by voluntary gatherings of civil society organizations finding a new purpose or repurpose that continues today. They provide support, sports and leisure activities. I mean, clubs and associations that would not function without the voluntary engagement of citizens, offers education and lifelong learning, gathers people in an interest-based group, many of you who are here, right? professionals, patient and thematic groups, youth groups, consumers, workers, trade unions, etc. And come together also in faith-based organizations and in community groups. I mean, in short, civil society is everywhere. We do more or less everything in society. And to limit the role of civil society is to make society less than it could be. It's to limit creativity and free thinking and all the things that you've been mentioning here. I think it's not overstating that it's the very glue of the social contract. And so the question perhaps is not so much what role can civil society be or have, but that it's rather impossible to imagine healing, or whatever word we would like to use, or imagining a different kind of social contract without us. From both a limited understanding of health to a more, as a specific issue, or from a more holistic approach of well-being, involving physical, mental, social and economic well-being, civil society is just simply irreplaceable. And to the second part of your question, then I think what is crucial for civil society and communities to take part in these processes and engage with policymakers and agencies and shape these processes, there has to be freedom and space to organize, transparency in process and planning, and funding made available and participation facilitated. It's very often the afterthought of any policy process to engage properly citizens and civil society organizations in policy making. I believe a core element of empowerment in this process is a sense of ownership, and if that can't be achieved, then at least of co-creation, of belonging, to be heard and seen. And this is true for our social contract and for public policies of well-being alike. They must fulfill people's needs and aspirations. And I think we can only achieve this by making sure that we listen, well, we then, as part of this panel, listen to what people say. And if good policy making requires collective intelligence, then civil society as a sector offers shortcuts to civic engagement and collective voices, as I just mentioned, organize residents, workers, experts, and community organizations. We should be made use of much more. Because I agree it's a communication exercise, but communication tends to be very one-sided, right? We want to communicate well what we think and what we do. But I think for participation to really happen, there's a lot of infrastructure out there. And if you want to be proud of anything, I think the very, very vibrant civil society that Europe has, for a wide range of topics and fields of expertise and knowledge, needs to be made use of much more. It's a very straightforward access to citizens participating in decision making and making their voices heard. So I wish we could do a lot more of that, and that you could make use of us as an actor in policy making to a larger extent.
Thank you, Mikael. We're very glad to be making use of you here and all the other members of civil society present. We'd never question the place of civil society. Gastein has its 4 pillars, including public policy, but also civil society. We do also, though, have 2 pillars which are not represented on the panel in the form of academia and industry. So I'm going to break with the structure of the panel for a moment. And pick on people. Don't worry, they did know. Barbara, from University of Vienna, academic pillar, what's your perspective on what you've heard and on the contribution of the academic pillar to the European social contract?
Thank you very much, Nick. So I'm talking as somebody who does research and who does a lot of policy advising. And first of all, I'm very happy to see that solidarity is in the center here. It's often an afterthought. It's often the thing that is seen as nice to have if the really important stuff has been dealt with, right? And as Mikael has said, solidarity is not an afterthought. If we want to be resilient as Europe, if we want to be proud of what we have, then we need to build solidarity into the DNA, not only of our healthcare systems, but in all policies. And crises, and we're experiencing many crises at the moment, crises are a bit of a magnifying glass on solidarity. We see regularly in crisis that we have a first phase of solidarity at the level of people. There's an outpouring of solidarity. And as people's batteries drain, if there aren't enough solidarity infrastructures in terms of social and economic support, people cannot be solidaristic at the level of individuals in a sustainable manner. And I think COVID has shown that. The lack of trust in government, the disenchantment with politics is not only an effect of that, but also an effect of that. We know that people lose trust when policies are not seen as effective and fair. So there are three things that I think we need to do. We need to create health policies that don't reinforce inequities, but go against them. And this sounds very trivial. It's not so trivial when we think about this sometimes going against short-term economic gains, cost savings, and a kind of economic notion of efficiency. The second is that citizens can not only be treated as patients or data subjects or data sources, but they need to be treated as partners. And the third one is really that we need to invest not only in medical infrastructures, but also solidarity infrastructures. Housing is one, social prescribing, a lot of the things that are being discussed here in Gastein.
Thank you very much indeed. I'm going to take that phrase of solidarity infrastructure. I think if I were to give the microphone to Clemens, he would also talk about things like the tax base as being part of the solidarity infrastructure and things like that. Part of the other theme, and Nicholas, you mentioned at the start, was the sort of the economic dimension of the social contract. And so, Thomas, can I come to you as part of the European Federation of Pharmaceutical Industry Associations?
Yes. Thanks so much, Nick. So yes, Thomas Alvim from FBR, representing the innovative medicines industry in Europe. So, looking back at what Clemens said on the tech industry, AI, the pharma industry is an old industry. We're not one of these new industries. We have grown up with the European social model from the beginning, anchored in the solidarity-based welfare systems, universal health coverage, something we very much believe in. Is based on people's needs, and that's our job, to find new solutions for the unmet needs and bring those to patients. And as an example, FBI has always been the forefront of measuring inequality of access to medicines in Europe. Not only why they're there, not only that they exist, but also why. And we're partnering with academia, public institutions in giant public-private partnerships. We collaborated very well during COVID to find solutions. Now, of course, this Europe's social model and also overall prosperity is under hard pressure, as been mentioned, from internal challenges and many external challenges. We have now huge trade policy pressures from the other side of the Atlantic and elsewhere. Unsustainable health systems is a problem for us all. The pressure on science, as was mentioned. We're in an industry based on science, and now when science is being questioned, also from political circles, that becomes a huge problem. Now, we believe that we as an industry have at least some of the solutions to some of these challenges in terms of ensuring economic growth and resilience in Europe and finding these new solutions for people and population health. But of course, pharma companies, also to be able to do this, we need to have the right conditions in Europe, where we can both invest in innovation and provide access for Europe and fast and equal access. And I think, given our very rapidly changing world, we believe that an urgent dialogue is needed with policymakers from member states and at EU level, so we can discuss how can we safeguard this future for Europe and do it together. Thank you.
Thank you very much. Thank you for bringing in that broader dimension. That will link very nicely to the next round of inputs I will seek from our panel. Before I do that, though, Floris, sorry to wake you. Do you have do you have any cartoons? Has anything struck you from the initial part of the discussions? I'm sure it has. We're getting there. In the meantime, oh no, there we go. I'm sure no one here, no one on the panel said that. Christina, I think we also have some comments from Slido. Are there any particular themes or issues that you would like to draw attention to?
Yeah, thank you, Nick, and also thanks to the online audience who've been very active during our session. So there have been comments on the effects of demographic shifts on our social contract and questions in this regard. So, for instance, how to motivate policymakers to implement maybe also unpopular reforms, especially with regards to financing. Then how to ensure that competitiveness does not only benefit industries, but also the population. Another remark was on recognizing health as a basis for competitiveness and economic growth in Europe. And then we also had remarks on the importance of equity and how to ensure that solidarity is not only a national principle, but lived at a European level, also with regards to innovation and financing.
Thank you. Thank you very much. Colleagues, we have a challenge. And it's not just the challenge of the social contract, it is the challenge of the clock. So, I really apologize for this. This is a testament to how interesting the contributions have been so far, but I think I'm going to have to ask you to keep yourselves to 2 minutes for this final round. And I wanted to build a little bit upon the points that Thomas was raising about this link to wider issues of trust, of sustainability, and of competitiveness. Minister, maybe I'm sorry to set you this challenge first, but if I come back to you, what are you doing in Slovenia? Let me just ask a sort of a general question around sustainability of health and care systems. This is one of the topics that was raised. What would you tell us from your perspective?
But in 2 minutes, right?
But in 2 minutes.
Okay. Yeah, basically, in the spirit of this positivity that we just created, I think I can say that in Slovenia we actually have a good system, a good healthcare system. Of course, there are challenges, and challenges are like similar as in other European countries, and we have to address them. And we do, with small steps, with small measures that we take every day to steer the healthcare system in the right direction. Now, if I say what is the guiding principle of this right direction, I would say solidarity. So every change that we make must be inclusive, must be fair, must be prepared in cooperation with all stakeholders. And this is why, because only if we do that, such changes will endure. Thank you.
That was less. There was even time for a round of applause, and still within 2 minutes, which is very impressive. Emma, can I come to you now? Because in terms of one of the specific challenges, if we link again to these wider issues, is around some of the global issues like supply chains and solidarity within Europe. What are you doing within EMMA to address those kinds of issues?
Yeah, so there's no way I can do this in 2 minutes.
Fair enough.
But I will say that we're doing a lot of work on managing shortages, particularly in crisis situations. And for me, this is the epitome of solidarity, because it's about how we see, where are the problems? Can one member state help another member state out? Can we even look at global solidarity? Can somebody outside the EU help us as well? And then can we share that information? Can we put a platform in place, like the European Medicines Shortages Platform? Can we put a platform in place to share that information so that we can be more reactive and prevent shortages in the future? There's a lot of work behind that, but this is about member states working together. This is about member states sharing information, and this is about collaboration and communication.
I think there was even less than 2 minutes again. Thank you very much. Pamela, I was going to say, no, the bar has been set high on this. In terms of, you struck such a note of optimism before about what we've achieved. This link to competitiveness and the link between competitiveness and solidarity, how do you see that, and how do you see it being well understood or not?
Well, health and competitiveness are sometimes discussed as if they would compete against each other. And I think this is not true, because one is the driver of the other. And I give you an example. I mean, it was the pandemic showing us that we in Europe, the European Union, must be more autonomous, more self-dependent when it comes to medical innovation. And yes, rightly, we discuss now well-placed incentives to get more European innovation in this field. But, and this but is very, very, very bold, and it came also from an online user right now, we have to make sure that this European innovation, with incentives behind, is driven by public health needs and not only by shareholders' needs. And I think this is of utmost importance. So public health needs need to be at the beginning and the end of any of these strategies. And ECDC, so who defines the public health need? I mean, there is ECDC. So we stand ready, you know, to provide our knowledge, to provide science, and to provide data, epidemiological data, to define the public health need when it comes to novel antibiotics, when it comes to critical novel vaccines. There we need to define the public health need in order to go into the right direction when it comes to innovation.
Thank you very much. Thank you again for being so concise. Sandra, may I turn remotely to you? The same challenge, I'm afraid.
Very much a challenge, yes.
So we've heard so much about this theme of competitiveness, and in Brussels, you will be very familiar with the Draghi report and with that whole agenda. Health was maybe not so much visible in that whole discussion. But if I listen to you from before, like, health is very much a part of this wider agenda and contributing to it. What would you say about that link between the two?
Well, first, a few numbers. I'm a numerical person. I would like to recall that the health sector is a major part of the EU economic activity. It makes up the spending more or less of 10% for every member of the GDP of every member state. So 10% is not peanuts. Health workers, do we want to know numbers? It's more or less on average 9% of the workforce. So numbers speak for themselves. It's important for competitiveness and for investment, this area. We have a European Competitiveness Fund. There's a proposal of the Commission where, you know, we have a recognition that investing in public health and health systems will be a clear winner if you want to access those funds. Let me also recall a very sad news that the demographics don't look good. By 2040, if my memory serves me well, there will be a shrinkage of the workforce by 2 million workers each year. So let me say to you, things don't look good. There will be positive spillovers when you invest in health. We have said that time and again in the brownie points that we give to the member states during the European semester. And let me say that just to go back to the issues of, I would say, disease, and I love the cartoon that was drawn for me. In 2022, we lost 2.4 million of work years, productive life work years in the EU, because people died prematurely. So let me say to you, prevention is also key. I would finish my thoughts with the fact that we have many proposals on the boil, including the pharmaceutical reform. And here, you know, we try to boost competitiveness. I'm very happy to see that FPI is present. At the end of the day, we are trying to bring to converge onto a place where all stakeholders find the best place, a regulatory environment that makes investment more attractive in Europe for a single market of 450 million consumers is something quite good. So I would say many things that bring competitiveness and investment to the fore. We are pulling all stops, and my hope is that in 2030, a renewed social contract, or what we have been discussing this afternoon, will be felt not in headlines, but in households. That is my most important hope, because health, it's at the core of the social contract.
Thank you very much. That's another line I'll be taking for the rest of the forum. Thank you, Sandra. Nicholas, this reconciliation of the social and the economic is a very familiar topic to you, I think, from your role as Commissioner. How do you see us being able to reconcile those tensions within the social model?
Well, it is obvious that the European social contract was always built also on a well-performing, competitive European economy. That was after the World War II, the growth period was allowing finally also the progress in terms of this European social contract. And that's why certainly we have to keep a very, very keen eye on competitiveness, on the strength of economy, but also referring to what was said at the beginning, to the tremendous changing technological, economic, geopolitical changes in our environment. And I think this is important to link that to good social policies, because if people get the feeling that they are the losers, and that's the danger of a broken social contract. If more and more people have the feeling we are the losers, nobody takes care, be it in the labor market, be it in the fact that social infrastructures are closed or underdeveloped because I have to wait weeks, months before I have access to a doctor or to a surgeon and so on. This is the big danger. So, talking about competitiveness, this is much larger than just the economic view. It has to be seen at a much broader level. So the societies as such have to be strong to be competitive. We have a lot talked during COVID about resilience. Well, resilience is economic, but it is also social. It is the fact that people get also the feeling that they belong to a community, national, but also European. I like very much, there's a book called What We Owe Each Other by Shafiq, former director of LSE. And we have a bit lost this view, what we owe each other. We have gone through a very individualistic period, and we have to rebuild this community, and that's about the social contract. That's about good health policies based on solidarity and not just on your credit card.
Thank you very much indeed. And last and therefore most memorably, Michele, from a civil society perspective, what do you see as the future direction of the European welfare state in the light of these wider competitiveness and global challenges?
Well, thank you. I think I'll make use of my minute and a half or so to emphasize something I think we haven't spoken enough about, and that's the ongoing environmental and climate disaster, that it's really, in a very speedy way, heading our way. And I think if it's anything that's sort of underplayed in the current, contemporary politics, it's the train wreck that we are on right now. So yes, the former system of our former welfare state were built on the promise, sort of idealistic, one might say in retrospect, of infinite growth, and a growth model that was based on extractive industries, an extractive economy. And that growth model is not working for us anymore. It's evident, if not for anything else, by the increasing social inequalities that we can't get out of, it seems, and the rapidly increasing climate and environmental disaster. So I think in addition to, I think the Draghi report and the massive investment gaps that he points to is one way to start doing something about this. We need to invest more in something that would look similar to a socio-ecological welfare state, because the environmental emergency and the growing social inequalities, they can either positively or negatively reinforce each other. I mean, in the process of a deteriorating environment, all the social inequalities, health emergencies and crises that we're witnessing will be only deteriorating, will only get worse. And if we don't manage that properly, not just in relation to competitiveness, but in relation to these transition policies and the emergencies that will come, again, something similar to the COVID pandemic, we will lose people in the process. And when they lose faith in the system, we have very little to sort of put up against it as policymakers, as civil society. So I think, in short, a socio-ecological welfare state within something similar to a well-being economy is the only sustainable and socially fair way forward. And I think the answer, sometimes when you say well-being economy, there's a lot of, what is that even, you know? What would that even look like? I think it's not really us who proposes this that are, you know, should be forced to answer. It's everyone who proposes a continued sort of track with quite minimal adaptations, while at the same time we say we believe in science. And there are thousands of scientists speaking very loud and clear for the past 15 years that we are continuing on a path that is unsustainable. And if we don't have an answer to their question, I fear we don't have an answer to anything, to be honest. But I think we can. So on a positive note, the project that we should rally behind to find the new social contract is this project. It's a very positive, very low risk project of trying to find our way back to each other and to nature.
Thank you. Colleagues, we've heard an enormous amount about the challenges facing Europe's social contract. We've heard about the different dimensions of it, but we've also had very timely reminders of what has been achieved and of the optimism and the good faith that we can have, and underlying all of that, of the importance of participation, engagement, talking to each other, and that's why we're here in Gastein. That's what we hope this will be a good launch pad for the discussions that we will have during the rest of the forum. Please join me in thanking our panelists for giving us such a good starting point.